Imagine someone that you have never met having access to your social security number, your blood type, and your complete medical history. If you were born in a hospital, if you have ever had surgery or visited an ER, then you have medical records. Hi, my name is Karen Miller. I've worked in the medical records field for over 14 years. I'm currently the medical records supervisor at North Metro Medical Center in Jacksonville, Arkansas. First, it's important to know how your medical records are stored. Your medical records may be stored in paper. If it's over 3 years old, they probably are stored in paper. One of the advantages of paper is that it's less costly to maintain. Some of the disadvantages are that it's not eco-friendly. It's bulky. It requires a lot of storage space to be used. It's also hard to decipher a lot of the doctor's handwritings. The other kind of medical record would be the EHR, or electronic medical records. I have a quote here by Randall Mays in 2012. EMRs will, in theory, provide more reliable and higher quality health care and reduce medical costs. Sharing medical data will hopefully eliminate hundreds of thousands of medical errors annually and provide better management of medical data and clinical treatment and medical research, accelerating medical discoveries. Some of the advantages of EMRs, or electronic medical records, are that they take up less space. It's easier to provide your other providers with access to your medical records from different hospitals or medical practices. It is more eco-friendly. It is more susceptible to theft, however. It's a lot easier to access a great deal of medical records at one time with the EMRs than it is with the paper records. Now that we know how your records may be stored, let's see what information may be in them. And here I have this quote from Arthur Shore in 2013. The major section of the medical record has reports about your care, the history and physical examination, your medical and nursing care plans that have been developed, charting and notations that have been made about your progress during your hospital stay, instructions and orders given by your physicians, medications that have been ordered and given, and when they have been given, results of diagnostic tests that were ordered for you, observations of your condition, and progress made by the physicians, the nurses, and other healthcare providers, your diagnosis and treatment. Some of the non-medical information that is stored in your medical records would be the consents that you have signed for surgery. It could also be your insurance cards, your place of employment, your religious preference, if in case you get so sick that you need a member of the clergy to come and visit you, your next of kin, and your address. Who can see my medical records? With some exceptions, you should be the only one who is able to see your medical records. Your physician will be able to see your medical records, of course, and other people who work in the medical records department. Also, you will be able to access your medical records if you come in and sign an authorization form. What you'll have to do is fill out an authorization form, and you'll have to present it along with your picture ID, and then you will be able to have access to your records. Another way you can do it is if you want someone else to be able to access your records, then you will come in. Again, you'll fill out the authorization form, but the person to release records to would be the name of the person that you would like to release your records to. Then they would have to come in and sign and also show a picture ID in order to access your medical records. The other people that can maybe see your medical records would be the police if they believe that a crime has been committed and that would help them prosecute the crime. Child Protective Services if they believe that child abuse may have occurred. Your workers' comp employer if you are injured on the job and are billing workman's comp. Those are some of the other people that can access your medical records. Can you be charged for your medical records? You can. Usually it's a nominal fee, and usually it's per page. So you'll come in and you'll say what you want specifically, and that will tell you that will tell the workers how much it is that they need to charge you. Usually it's a small fee, such as like 50 cents per page for the first 25 pages, or 50 cents a page after that. One way to do that, to do it frugally, is to just get your discharge summary or just the results of your tests instead of getting the entire medical record, which you probably couldn't decipher in the first place. I hope that this has been, how long are your medical records kept? Your medical records are kept as a general rule for 10 years from your last date of service. Also, if you are a minor, your medical records are required to be kept for at least 3 years after you turn 21. I hope this has been informative for you, that you have learned more about how your medical records may be stored, what information may be in your medical records, and how you may access your medical records. Thank you.